morning, everyone. Thank you for joining us today for our waiver review Skype meeting. We haven't done one of these for a bit, so we just kind of wanted to recap kind of the process for the waiver review. So basically, on a quarterly basis, some of our performance measures are reviewed on a monthly basis, but the majority are a quarterly basis. So we have several performance measures for the waiver that fall into several categories. We review those on a quarterly or monthly basis. We get together as a waiver review committee every quarter after all of the data is kind of aggregated and totaled up. We get together as a waiver review committee to review those results and kind of determine if there's any recommendations that we have for improved performance. So the threshold that CMS kind of expects for our compliance rates is 86%. And so if anything falls below 86%, if there's some areas that we feel like we're dropping in performance, we kind of talk about to determine if there's anything that can kind of improve the performance in that area, and then we make those recommendations. And so that's kind of what we'll be talking about today. We will be using a little bit different format than we have in the past. We're just going to have one slide that kind of shows the performance for everything, and then a recommendations slide that shows any recommendations that were made within each category. We will also be talking about our new services and give some updates on them as well. So the review here today, we're in year 2 of the waiver, and what the quarter that we are reviewing is quarter 4. So the first category for the performance measures is an administrative authority. So we had, as you can see, all of our performance there was above the 86%. We did have, for the first one there, new applicants that were enrolled by the operating agency according to 674403. So there's several things we look at here, including, did the person have a level of care? Were they in an approved setting, such as home or assisted living? Were they approved by EA, and did they have a care plan and cost of services on file? So we look at several things for this one. What we found is it looks at only the new applicants, and the areas there, what we found is there was 1 that didn't have a care plan and 3 that did not have a care plan or cost of services. But as you can see, our performance is still well above the 86%. So we don't have any recommendations for this area. For the service plans exceeding the cost of nursing facility care that were approved according to the exceptions process, we did just want to have a reminder. We had 100% compliance there, but there were a couple that we had to look into just really based on some errors in SAMs. And so just a reminder that you'll want to just make sure that you're careful, I guess, when entering the information for the care plan.
Okay, for the next section, we have level of care, and as you can see there with the compliance rates for all 4 of the performance measures, we did very well this quarter. We don't have any, we do have some recommendations. For the level of care requirements, a level of care is required for each setting change, even if the setting change is short-term. We've recently had some issues with economic assistance where the benefit specialist was told by LTSS staff that a level of care was not needed because the suspension of the waiver was less than 30 days. There was some back and forth that we had with EA where there was some confusion about the level of care not being required if it's under a certain amount of time, and that is not true. For any setting change, even on one that's under 30 days, a level of care is required. And then we also had some questions regarding psychological therapy and how to document the CHA. For level of care determination for waiver, weekly therapy is one of the eligibility criteria, and so we had some questions about what staff should be marking in this area. So for K2 on the functional supplement of the CHA, there's a section for psychological therapy. And as you can see there, the definition is therapy given by a licensed mental health professional such as a psychiatrist, psychologist, psychiatric nurse, or psychiatric social worker. That is the CHA criteria. So what we've decided is if the therapy the person is receiving meets that definition, go ahead and code the CHA to indicate the number of days and the total minutes of therapy received in the last 7 days. If the therapy the person is receiving does not meet that definition, do not code this section, but rather in the CHA notes for K2, indicate the details of what the person is receiving and by who. So for example, they're receiving case management services by a case manager that's practicing under a licensed therapist at such and such a business, or, you know, any detail in there where the MRT team can determine that the person is receiving therapy. It's just not under one of those specific professionals. Does anybody have any questions? You can feel free to type in the Q&A or unmute your phone or, your laptop and ask through the speaker. Okay. Well, I hope that's clear. Like I said, if you have any questions about it, feel free to email Misty and I if you have a specific situation that you want clarity on. Okay.
Okay, so moving on to service plan. As you can see here, for the most part, we do have compliance above the 86%. However, we do have just a couple. The first one there, consumer care plans that address all assessed needs, was just a tad under the 86%. And then the consumer care plans that are developed in accordance with the state's policies and procedures. Again, that's kind of a total of all of the performance in this area. So it's typically one of the lower performing areas that we have. So as far as recommendations and reminders for the service plan, we did just want to let everyone know in case they weren't aware. We do have the quality assurance specialist, Jennifer Murray and Jeanette Hansen. Previously, the supervisors were completing the service plan reviews for these performance measures. We have changed that since the quality assurance specialists have been hired to actually complete those. So we thought that would help with the consistency of the service plan reviews. So they will be completing those moving forward. I believe they did their first set just this month. So you may have received some correspondence from them with questions or maybe requesting a care plan, those types of things. The other thing we just wanted to note, I don't believe we had the webinar after the last quarter, the quarterly waiver review committee. So we did just want to, we don't have any significant recommendations in this area, even though there are, like I said, a couple of performance measures that are below the 86%. Last waiver review committee, though, one thing that was identified was there were some new staff that did not receive care plan training, and they had some remediations. So one of the recommendations from last time was to make sure that everyone was caught up on the new staff was caught up on the training, and so we did hold a care plan training on September 18th. We do hope that maybe will be reflective in the next set of performance measures for the next quarter. And then, of course, as you all are likely aware, we are working with Therapy Services to implement a new IT system, and we're also hopeful that at that time we'll be able to kind of take another look at the performance measures and what we're looking at, and if there's a different way to measure them, or maybe some helpful things that will just increase the performance in those lower performing areas. So no significant recommendations this time because of these things.
So moving on to health and welfare, as you can see, we did very well in this section as well, with exception of complaints that were addressed within the required timeframes and critical incidents where appropriate follow-up occurred. And then just a quick note, I think we have some recommendations on the next page, but On the incidents of restraint and seclusion where appropriate, or where survey respondents reported they were not restrained, we did have 2 this last quarter that were being restrained. That was truly what was happening, but in both scenarios, the specialist followed up on it appropriately. For recommendations on the complaints and the critical incidents, I think I'll turn it over to Jennifer. Can you unmute yourself and talk about the updates that were made to SAMS? Maybe I can unmute you. Okay.
Hello, this is Jennifer. Can everyone hear me?
Yeah, I can hear you.
Okay. I added a couple workflows in SAMS to help with the complaint journals. I did send out an email, but I'll just added a journal with the journal type of complaint. And after you save that journal, you'll get a pop-up message that reminds you to follow up on the complaint within 1 week. And that's just from the complaint policy itself, just a reminder. When you enter the journal type of complaint follow-up, after saving the journal, you'll get another pop-up message that says that a resolution to the complaint itself is due within 30 days of the initial report of the complaint. Again, that's right from the policy manual itself. Lastly, in order to catch some of those journals that should be entered as complaints but are just entered maybe under the narrative or some other type of journal type, if the subject of the journal has complaint, complain, or anything similar to that but does not have one of the complaint journal types selected, it will give you that message basically saying, hey, is this actually a complaint? If so, please follow the policy manual regarding the complaint process to make sure that you are choosing those complaint journal types when it is appropriate. So it's just kind of a reminder to choose the correct journal type. If you have any questions about that, let me know or speak up now and I can hopefully help you with that.
Thank you, Jennifer.
So just kind of as some further information on that, one of the things in the waiver review committee that we discussed is that we aren't really sure that people are entering complaints. Maybe, you know, you'll have a 6-month call or a quarterly call or a 6-month visit or a quarterly call or some other call with the consumer where a complaint kind of comes up. So just a reminder that any time that there's any complaint, you do have to use these journal types. Otherwise, we're unable to pull them for reporting purposes and review them for our performance measures. We really do want to capture all complaints just so we kind of have a record of those things when issues come up with providers, or, you know, if there's complaints about services not being provided, that we would follow up with our Medicaid office to ensure that our consumers are getting quality care. So just again, these were kind of put in place to make sure that we're both following up on complaints and that we're actually entering them as complaints so that we can capture them here.
Yes. In addition, as you can see there on the other 2 bullets there's going to be a pre-review of complaints by the quality assurance specialists, Jennifer and Jeanette, and then I also believe we're going to start sending kind of a report to have the supervisors kind of do a pre-review of critical incidents, and that's just to try to help remind staff to, you know, close out those complaints or get the critical incident review done within the time frames and whatnot. And so it's just intended to be a helpful reminder, and we're hoping that will also show that allow our performance to increase with those reminders.
So Leslie, excuse me, this is Beth, if I could jump in. That pre-review, that's prior to the critical incident review team meeting. Correct. To actually review the complaints that pull onto your list that you review. So from a specialist perspective, their process doesn't change.
Correct.
They do the process, they follow the policy, they do their documentation, and then prior to the critical incident review team meeting here at state office, there will be an additional review process that will occur before that critical incident review team or that complaint review team kind of
try to, you know, help us with our performance and make sure that everything is done according to policy prior to the state CERT team reviewing it for performance measure. for the waiver performance.
So I just wanted to reiterate to specialists that, the process does not change on your end. It's kind of an internal process that we're going to implement to assist with that performance review. So you may be getting, some follow-up by the quality assurance coordinators asking about a particular case that they are reviewing. However, the day-to-day process does not change for you.
Correct. Any questions about those before we move on?
Just one additional comment related to that is, so if you do receive, so one of the areas of kind of concern for the complaints especially, was that they're not being resolved in the time frame required. Usually is what was happening. They weren't being resolved or closed out within 30 days. And so if you do get a notification, again, this process was really put into place not only to ensure our complaints are being resolved and those types of things, but just we understand that those things can be forgotten, and so it's really kind of to help you too. So if you do get feedback from them, we highly encourage you to make sure then to use that reminder in your favor to make the necessary follow-up or complete the necessary follow-up.
Yeah, a lot of the times what we see is maybe the specialist has reached out to the provider and they're waiting for the provider to call back, and then the provider never calls back, and so you just kind of forget about it. So it's just an attempt to put out some reminders so that we don't miss getting these complaints and critical incidents followed up on. Okay, moving on.
Okay, so the qualified providers is another area that we measure some performance, and as you can see here, we do have above the threshold here, and this is just an area we typically do well in, so no problems or recommendations noted here. And then moving on to financial accountability. So financial accountability is really a look at both our claims that are being paid to ensure that we're paying all of the correct claims, as well as are people receiving their services and our providers not billing services that weren't provided. And then it's also a look at kind of our rate methodologies and those types of things. So the performance, as you'll see in the first couple of areas, is 100%, so everything going well there. The reason that the survey respondents who reported they received the services that are authorized, our performance is a little bit low there. We haven't completed the review. Essentially what we look at there is if the consumers report that they don't always receive the services that are authorized in the prior month, this is according to the data on the consumer experience survey, we have to do some follow-up with the providers, and so that hasn't been completed. We haven't received back the feedback from all of the providers yet, and so that one is likely going to increase, but we did just kind of want to put a note here too, which we'll talk about in the recommendations here. I guess as far as the other three, there are a few in progress. Those are related to rates and rate methodologies, as well as rates utilizing the state plan fee schedule. We do have to do a lot of follow-up with the providers with that as well, so it can take a while. So those three are in progress, but we did just have some reminders for the survey responses. For the performance measures, survey respondents who reported they received the services that are authorized, and again, this is going to be on the consumer experience survey, specifically question D3, which is I received all of my services in the previous month. We just want to make sure that you remember to ask the consumers which services they did not receive and include that information in the survey notes. We would like for you to be as specific as possible. So for all of the ones that specialists mark weren't always, we have to do follow-up with providers, and there were quite a lot of those this time. So again, we just want to make sure that we're asking specific questions about why the services weren't received, so we know what we need to look further into. It will really cut down on the follow-up necessary for those. So some examples would be if they report they didn't receive their incontinence supplies last month, or maybe the homemaker didn't come for 2 weeks in January. Again, just most of our consumers, as you're aware, have multiple services and multiple service types as well. So just really making sure you're more specific there.
And honestly, if you can get even more detail than that, for example, on the homemaker didn't come for 2 weeks in January, for us to do the review, it'd be really nice to know what dates those were that the homemaker didn't come, because we're going to ask the provider to share with us their case notes for that consumer, and we're going to have to compare dates and make sure that they did not request a claim or request payment for any of the dates that the consumer has reported to us that the homemaker did not come. And just a note about the assisted living, if a person resides in assisted living and they answer anything other than always to that question, we really need to be thinking about that, because the service that we're providing to them is the assisted living service. So if, for example, they say, yeah, well, I didn't get a bath yesterday, that's not really the service that we're providing, and so really that's not the question we're asking. So be specific in the notes. So if you say something like they answered sometimes, but they indicated they didn't get a bath yesterday, then we'll at least know that it's not about the assisted living service itself. For them to not receive the assisted living service, they would have to be out of the assisted living for more than 5 days for them to not receive the assisted living, and for the assisted living not to be able to make a claim for those dates of service. Any questions about that, feel free to email me and let me ask me, because I'd be happy to provide more specific guidance for any particular questions.
So the next thing, we just want to kind of do an overview of the new services. Again, it's been a while kind of since we've talked about these, and we're still in the process of kind of the implementation. So we wanted to just kind of give an update and get a little more information out regarding the services. So as a reminder, these 4 services were approved effective August 1st, 2018. We've really been working with providers in an effort to implement the services. But we just wanted to kind of recap what these services are and kind of the definitions and those types of things. So Community Transition Coordination is one of the services that was added. This service is available to individuals that are transitioning to a less restrictive setting. So for example, they might be in a nursing home and going into an assisted living, or they might be in an assisted living going home. They're just transitioning to a less restrictive setting. The individual must have at least 1 Medicaid eligible day. This service itself will assist in identifying, selecting, and obtaining paid and unpaid services and integrated housing options. It would be available for 180 days prior to the anticipated transition and for 60 days following the date of waiver enrollment. The Community Transition Coordination, these would be performed by an outside entity. So we're working with, currently working with Benchmark, has expressed interest in providing this service. So we're working with them to hopefully move forward with being able to contract with them and provide this, having them provide this service. But Community Transition Coordination for community transitions shall be person-centered and would include the initial assessment and ongoing reassessment of the individual's strengths and needs, the development of a care plan for the transition, evaluation and revision, assistance to access service providers, assistance in identifying and securing integrated community housing, information and education on HCBS and HOPE waiver service options, including the individual's rights and responsibilities, as well as ongoing monitoring of the transition plan and its implementation. So the other piece for community transition services is really that supports piece, which is it can be a security deposit required to obtain a lease for an apartment or house. It could be moving expenses required to occupy and use the residence. It might be one-time non-refundable deposits or installation fees to establish utilities such as electricity, heating, water. It could be a one-time residential cleaning or pest extermination costs, again required for the individual to occupy the residence, non-medical transportation necessary to the transition, or essential household items necessary for its successful transition as determined by a needs assessment. So again, these community transition supports are really going to be things that can be purchased in order for the individual to be able to transition into a less restrictive setting and be successful. This is some additional information regarding what household items might be included. Furniture, small appliances, one-time setup or initial setup for groceries, household supplies such as hand soap, cleaning supplies, paper towels, those types of things that you typically need to establish a household, bathroom, kitchen, and bedroom linens. Again, the community transition case manager, like I said, we're working with Benchmark in hopes that they'll be able to provide the coordination and also be able to purchase them these supports as part of that. So that transition case manager would accompany the consumer to purchase the essential household items, and the total cost of the essential household items should not exceed $500. So the essential household items, again, are these things you see here on this slide.
Okay, so moving on to the two new residential options, the first one being community living home. This provides an alternative long-term care option to individuals who meet nursing facility level of care, whose needs can be met in a less restrictive environment. It is very similar to assisted living, but just on a smaller scale. The residents may be owned, leased, or rented by a community living home provider. They must be licensed by the Department of Health. They must ensure that the basic health and safety needs of the participant are met 24 hours a day, 7 days a week. The maximum number of participants that can receive community living home services in one residence may not exceed 4 people. And this is reimbursed at a daily rate with 3 tiers, which we'll get to here in another couple slides. This just kind of, I'm not going to read through this whole thing, but it just kind of gives you an idea of what is included in the rate for community living home providers, and then what may be authorized for separate payments. So you can see there are some services there that we will allow to be authorized above and beyond the community living home based on assessed need. This talks about what may not be authorized. So meals, homemaker, chore, emergency response, and EAA is all cannot be authorized for separate payment within a community living home. And then, of course, just like assisted living, payments are not made for room and board, items of comfort or convenience, cost of home maintenance, etc. For structured family caregiving, this provides care and supervision for the participant through a relationship between the participant, the principal caregiver, the participant's HOPE waiver case manager, and then the Medicaid enrolled structured family caregiving provider agency. It provides an alternative to long-term care. The structured family caregiving home must be the primary residence of both the principal caregiver and the waiver participant. The Medicaid enrolled agency may not own, lease, or rent the residence. The resident must be owned or leased by either the principal caregiver or the participant. And the number of participants actually receiving structured family care service in any one private home may not exceed 2 participants. And then finally the structured family caregiving principal caregiver may be a related family member or a non-relative fictive kin. And a fictive kin is, the definition of fictive kin is somebody that's like family, somebody that they feel like is their family, and it's pretty open for interpretation, but we wanted to be able to have some leeway with who that principal caregiver could or could not be. And then if in a structured family caregiving environment the principal caregiver ends up not being a relative or fictive kin, then we made it allowable that home could be licensed by DOH, but still be able to provide structured family caregiving. Here again is a listing of what's included in the rate for structured family caregiving, what may be authorized for separate payment, and then on the next slide I believe is what may not be authorized for separate payment. So the assumption here is that meals, homemaker services, chore services are what the principal caregiver is providing to the consumer, whereas these services that may be authorized, for example, adult companion, adult day, or respite care, the principal caregiver might need those services above and beyond what they're already providing to the family. Again, all of this is based on an assessed need, and this would be done by both the LTSS specialists that assigned to the case as well as the structured family caregiving community engagement specialist. So just a quick glance comparison between the two, because starting up two new services at the same time, two new residential options at the same time, it has gotten a little confusing for those of us here. So we just kind of wanted to do a quick glance where you could kind of know what the differences are between them. And then here shows what the rate tiers are and what is looked at, the criteria that's looked at for determining which tier the individual will receive for either of those residential models.
Just something to note here as far as the rate tiers for the residential models. So with the structured family caregiving, this is the rate that would actually go to the structured family caregiving Medicaid enrolled oversight agency. So this isn't necessarily the rate that the caregiver themselves would receive. So just kind of I guess a word of caution when talking with families about this. It's not, again, this isn't the rate that the caregiver would receive for the care. So there would be a pass through of this amount to the caregiver.
I believe the requirement is that the oversight agency must pass through at least 50% of the daily rate. But I believe they can choose to do more if they feel that the family doesn't need a lot of oversight or caregiver support.
Okay, so then we just wanted to provide also kind of a status update on where we're at with the implementation of each of the new services. So with community transition services, including both the coordination and the supports, like I've mentioned, Benchmark has expressed interest. Currently, they're the only ones that have really expressed some significant interest in the service at this time. So we have had some meetings with them to talk about the service, and they are currently reviewing the provider provision, which is the supplemental agreement piece of the service. So we have a question here as far as what date those transition services will be available to our consumers. At this point, I don't really have a date. I can tell you that we're making progress in that area. We're hopeful that Benchmark will be willing to provide the services. But as far as when that'll occur, I can't really say. I'm hoping that it'll be soon, but I can't really make any guarantees. Again, it'll be dependent upon what kind of feedback they have, if they're still willing to do the service. If they're not, obviously we'll have to explore other avenues and other providers. But we are hopeful that they will. So we're hopeful that the service will be in place sooner than later. Unfortunately, I don't have a date for you today. I will say, though, with the community transition services, one of the things that we did write into the waiver is things like medical equipment and environmental accessibility adaptations. If those things are needed prior to a transition, we could potentially provide those at this time. We would just go ahead and likely work through the regular providers of those services at this time, but we could explore having those things available by the time the person transitions. It's really those other essential household items and those types of things that Benchmark would have to, or another provider, whichever provider would have to purchase that we're not quite set up for. So if you do have any individuals that are really just needing some equipment or maybe a home modification prior to returning back or returning to the less restrictive setting, get in touch with me on that and we'll work through that. As far as the community living homes, we do not have any enrolled providers at this time. So over the summer, Leslie and I and a couple others met with, along with DOH, met with some potential providers. None of them have enrolled to this point. So we've had some outreach with several providers. We've kind of developed some informational type handbooks for both the community living home and the structured family caregiving home that have been given to some providers, potential providers, but at this point we don't have any for the community living home.
I did receive a call from a provider in the central north area of the state that actually the organization owns a home. It's like a 4-bedroom home, and I spent a lot of time talking to her about community living homes and sent her a lot of information. So I hope to hear back from that provider, and then I think as soon as one or two of them kind of embrace this new residential option, that potentially other providers will kind of see what's going on and take a chance at opening one as well. So we'll see. We're just going to keep an eye on it and keep working with DOH to try to encourage providers to develop these.
So moving then on to structured family caregiving. So we are working with a couple of providers. Senior Link is an out-of-state provider that has a lot of experience with the structured family caregiving. So again, this would be the oversight agency. They are in the process. They're getting close to completing the enrollment process and contract process. So we anticipate that within by the end of February, we should be able to have some structured family caregiving services potentially at least in place and hopefully begun soon thereafter. We are again working to identify potential candidates for this service. We will be implementing the service beginning in eastern South Dakota and then kind of rolling it as it progresses and we have more candidates for this service. We will move throughout the rest of the state. So again, we're very close with the structured family caregiving and having an approved provider to provide that oversight. And we will be having some trainings in the Sioux Falls area mid to late February. So again, within the next month or so, we should be able to get this service kind of up and running.
We don't have any dates for that training yet, but we will try to pinpoint that as soon as possible so all of you on the eastern side of the state can get that on your calendars and be able to come.
So then as far as we wanted to also give an update on environmental accessibility adaptations. As you all know, this has been a service that's been available in the waiver for quite some time now, but it's been really a struggle to get some providers on board to complete these adaptations and really figuring out how to implement them. However, we are happy to report that we have done a few pilot environmental accessibility adaptations. Again, we wanted to make sure all the billings and everything went through pretty smoothly. And so we have done some of those, I believe primarily in the Sioux Falls area, but a few maybe in Brookings, maybe one in Brookings. So we hope to release that policy in February. So we've done these pilots, made some updates to the policy based on feedback and maybe things that didn't go as smoothly. We got some, we had some billing issues, of course, to begin with, but I think those are all ironed out. So we will be planning to release that policy in February. If in the meantime you have any candidates, you can, let me know and I can get you that policy. That's typically what we've done, is just forwarded the policy to staff and supervisors that have potential candidates in the area. Unfortunately, in the Rapid area at this time, we haven't been able to pinpoint a provider that can do this oversight. The provider for the environmental accessibility adaptations isn't the contract entity. It's actually the entity that will be overseeing, getting the contracts, monitoring the service itself, and then doing a final report to ensure it was completed to the consumer satisfaction and is going to be usable. We really feel that it's necessary to have that oversight in order to ensure that our Medicaid dollars are being spent appropriately. So that's what the provider entity is for those situations. And like I said, to this point, I reached out to many potential providers and just haven't gotten one that's going to be able to do it to this point. We still have a couple in mind, so we're going to be continuing to reach out to those providers, but at this time we don't necessarily have one in the Rapid area. So that's unfortunate, but the fortunate thing is that we have been able to complete some of these, so we will be releasing a final policy hopefully here in February still.
Now there's a question in the Q&A. It says, for individuals that are in need of transition service, should staff continue to forward those names and descriptions and situations to Misty and Leslie? Yes, please. And that goes for structured family caregiving as well. it's helpful as we start to work with the providers, those that have expressed interest, to be able to say, here I have these 10 individuals waiting for transition services all in this area of the state. So it is very helpful that you send those in to us, and we've just been kind of keeping a folder with all those referrals so that when the service is available, we can be sure to share those names with the provider and move forward with those transitions or structured family caregiving service. The other thing I wanted to mention is we don't have any confirmed timelines for you, but the intent is for the structured family caregiving service, once we get started up on the eastern side of the state, that it will be a relatively short amount of time until the service is available statewide. So we hope that process doesn't take too long, but being that it's a new service with a brand new provider, we don't really know specifically what kind of timeline we're looking at, but I would expect in the next 6 to 9 months maybe that it will be available across the state. At least that's what I hope for. And the question, what do we do in the meantime for people who need to transition ASAP? Well, we have had a couple of situations where, unfortunately, the LTSS specialists had to do a bit of the legwork that normally the community transition specialists would have done in their place. For example, I believe we had a case down in Sioux Falls where our specialist was doing the, kind of going with mom to look for apartments that were suitable and whatnot. And so, unfortunately, right now, that's kind of where we're at. If you maybe need help with that, get a hold of us just to make us aware that, maybe we can help work through that situation with you until we can get this service available. Like Misty said, we have had those conversations with Benchmark, and they are interested. It's just the matter of going through the steps for the contract and getting that provider enrolled for that service. So we hope that it won't take too long.
Yeah, unfortunately, with the supports piece of that, there's really not a lot that we can do until that enrollment process is complete. And they're the only ones that can bill for the service. So unfortunately, the only recommendation I guess I would have is to reach out to other entities that could potentially provide some of the support services, and continue to do that.
Yeah. We'll hold off here to close it for a couple minutes. If any of you have any other questions or want to unmute your line and ask it through the microphone. I also recorded today's session, so as soon as it's available out on the internet, I'll send an email out so anybody that was unable to participate today can listen at their convenience. Well, I don't see any questions being typed in, so thank you for participating in today's webinar, and feel free to reach out to Misty or I if you have any questions about any of today's information, and have a great rest of your week.